Okay, thank you. Good morning, everyone. Um, I'm back. This is Carrie Morgan again, and I'm here today um, to talk to you about safe and effective defibrillation, cardioversion, and transcutaneous pacing. Um, in an effort to really improve visibility of what we're doing in the device, what I did is I prepared a video for us today so that you could really clearly see things up close and personal. So I'm going to go ahead and start the video now. And if you have questions, if you don't mind just waiting till the end of the video, it's about a 25-minute long video, then we'll be happy to um, have any discussion or answer any questions at the end of the video. So I'm going to go ahead and start it now.
Today we will review safe and effective procedures for defibrillation, synchronized cardioversion, and transcutaneous pacing in children. We will be using the Zoll R-Series defibrillator device to do this. It's important to become familiar with your institution's specific device, as there may be differences in functions and features. We recommend contacting the device manufacturer's instructions for use manual, their service representatives, and/or your institution's educators for training on your specific device. Let's review this device's controls and indicators. Starting with the screen, it displays settings, waveforms, messages, soft key labels. There is an AC and battery indicator, code readiness indicator with a check mark, mode select, either off, the monitor, defib, or pacer, the energy select button, the charge button, the shock button, the analyze, which is ECG analysis and advises when to shock, lead, size, and alarm suspend buttons, the recorder button, which starts and stops, pacer output, pacer rate, and the 4-to-1 button, the NIBP button, and finally the soft keys that are labeled at the bottom of the screen and will change with the context. Now let's take a look at the display screen. Here's the elapsed time, the time since the unit was turned on, CO2 levels, respiratory rate, NIBP readings, SpO2 levels, and signal strength. Each has an alarm status indicator, CPR rate and depth indicator. Now, if we proceed to the back of the device, we will find the cables and connectors. Here's the sync in, marker out, or ECG out port. Here is the NIBP port for connecting blood pressure cuff cable, it's black. And here is the end-tidal CO2 port for connecting the CO2 monitor cable, and it's yellow. The ECG port is for connecting 3 or 5 ECG cables. The SpO2 port is for connecting pulse oximeter cable, and it's blue. The one-step therapy cable, red, is for connecting the paddles or the Zoll hands-free multifunction electrodes or pads. Here's the power cord. It's used to operate the device when battery power is not being used. It's important, though, when the defibrillator is not in use, that it be kept plugged in. On the sides of the device are the external paddles. To use, attach the one-step cable to the apex paddle. To detach, press the release button in the direction of the arrow. Paddles include controls for selecting energy, charging, shock delivery, and turning the strip recorder on and off. Pediatric size electrodes are built in under the standard plates. Press the PD button to remove and slide the plate upward. On the top of the device, you will find the battery pack. Press the index finger button to check remaining charge. Green indicator lights are 30 minutes each for a total of 4 hours. If you see a yellow light in the question mark or a red light in the X sections, inform medical engineering. On the top of the device, you'll also see the recorder tray. To load, press the button and insert the paper as the picture inside the tray. There should be a folded crease to the top right with the black arrow facing towards the back of the device. The recorder will auto-print before and after each shock, or you can press the recorder to start and stop at any time. Let's now review the multifunction pads. Ensure the multifunction pads are connected to the therapy cable. To disconnect, press where indicated and pull apart. The unlatching mechanism works similar to a clothespin. To connect, place the lightning bolt up and push to connect. To select the appropriate size, refer to the weight recommendations on the packaging or recommendations from the manufacturer. Before applying them, ensure the skin is dry and free from hair. To apply, press and roll them firmly over the skin. Be sure not to place them over ECG electrodes or wires. These pads have a CPR puck. When positioning pads with the CPR puck, ensure the horizontal line is aligned with the patient's axilla and vertical line is on the center of the sternum. You will receive messages such as check pads and poor pad contact if not making good contact with the skin. This is important to correct, as poor adherence or air under electrodes can lead to undelivered therapy and/or arcing or burns. Let's now review manual defibrillation using multifunction pads. Apply hands-free electrodes. Select defib. Note the unit defaults to energy depending on which electrodes are connected. For example, for adults, it will default to 75 joules, next shock 150 joules, and next shock 200 joules. If the pediatric pads are connected, it will default to first shock 10 joules, second shock 20 joules, and third shock 30 joules. Be sure to verify the energy selected as appropriate for the patient and adjust as needed. Recall that pediatric advanced life support recommendations for weight-based dosing for defibrillation starts at 2 joules per kilo, then 4 joules per kilo, and then can increase up to 6 to 10 joules per kilo. Next, charge on panel. Note that changing energy after the charge disarms the device. Therefore, you'll need to press charge again. The shock button lights up. You'll hear the charge ready tone. Then defib ready displays. Call out stand clear and oxygen clear. Visually ensure oxygen is clear and no one is touching the patient or bed, and the patient is not in contact with metal objects, as this can cause unwarranted pathways for defib currents. Then press shock. A joules delivered message will then appear on the screen. This device also has an analyze or AED mode. This means that when selected, the device performs ECG analysis and advises when to shock. This could be a helpful mode if the provider is unable to analyze the ECG. This is not the preferred mode at our institution. To use this mode, apply the multifunction pads. Select defib. Select energy. Again, the unit will default to energy dependent on which electrodes are connected. Verify energy selected as appropriate and adjust as needed. Press the Analyze button. Do not touch or move the patient. You will get an analyzing ECG message for about 6 to 12 seconds. If a non-shockable rhythm, it will display a no shock advised message. If a shockable rhythm, it will display a shock advised and press charge message. Press the charge button. Changing the energy level after charge disarms the device, so you'll need to press charge again. The shock button will light up. You'll get a charge ready tone, and you will see defib ready displayed. Call out stand clear and oxygen clear. Again, ensure oxygen is clear and no one is touching the patient or bed, and the patient is not in contact with metal objects, as this can cause unwarranted pathways for defib currents. Press shock. A joules delivered message will appear on the screen. and then after the shock has been delivered, will be replaced by a defib Joules select message. The device will then prompt to perform CPR for 2 minutes, then will prompt to press analyze again. Okay, let's review manual defibrillation using paddles. Connect the therapy cable to the apex paddle. When the therapy cable is connected to the paddles become the ECG source in monitor or defib mode. Select defib. The unit defaults to pre-configured first shock energy selection starting at 75 joules, second shock 150 joules, third shock 200 joules. Be sure to verify the energy select is appropriate and adjust as needed. Weight-based dosing for pediatrics for defibrillation starts at 2 joules per kilo, then 4 joules per kilo, and then can increase from 6 to 10 joules per kilo. Prepare paddles and apply defib gel pads to the patient. Apply paddles to the chest. You can adjust energy select on the front. Press charge on the apex handle or front panel. You'll get the charge ready tone. Defib Joules ready will display. Call out stand clear and oxygen clear. Apply 22 to 26 pounds of pressure to each paddle to minimize impedance and optimize results. Press shock using thumbs simultaneously and hold until delivered. X joules delivered and defib Joules select messages appear for 5 seconds, and then only the defib Joules select message. Note that if the defib is not discharged within 1 minute after reaching selected energy level, the device will disarm itself. Press charge to recharge the device. This device also has a see-through CPR feature, meaning that when chest compressions begin, the device filters out the CPR artifact a few seconds after detecting compressions. When the CPR filter is on, the rhythm becomes more obvious. The filtered ECG with the label FIL will be displayed on the second trace. Zoll recommends that clinicians stop CPR to make an official analysis of the rhythm prior to making a shock versus no shock decision. This is also the practice at our institution. When using the one-step multifunction pads, the ones with the CPR puck, the device provides feedback on the quality of CPR being provided. Let's review CPR feedback when using the adult-size multifunction pads. The CPR timer shows the elapsed time since the last detected chest compression. When compressions are being delivered, the time display will be blank. The CPR depth and rate are highlighted if they are not within the American Heart Association recommendations. For adults, aim for 5 to 6 centimeter depth and a rate of 100 to 120 compressions per minute. When the compression depth is too shallow, you will get an audible push harder prompt every 15 seconds. If the compression depth increases to more than 5 centimeters on a consistent basis, you will get a good compressions prompt. Audible prompts are not issued for compression depths that are too deep, such as those greater than 6 centimeters. A metronome will sound when the compression rate is above or below the American Heart Association standards. This is to encourage you to perform chest compressions at the recommended rate of 100 to 120. The metronome only beeps when compressions are detected below or above the recommendations. A chest recoil bar indicator shows release of chest compression by the rescuer. The bar should be filled to the top. Here we are not allowing enough chest recoil and the bar is not filled. Here we allow full recoil and the bar is fully purple. The Perfusion Performance Indicator, or PPI, provides an overall indicator of how well the rescuer's combined rate and depth match the AHA recommendations. The diamond starts to fill from the center out as compressions begin and becomes fully filled when requirements for depth and rate are consistently met. Following the cessation of compressions, the PPI's fill level gradually decreases. If you resume compressions at the AHA recommended rate and depth, the diamond will gradually fill again. Let's now review CPR feedback when using pediatric multifunction pads. The feedback when using the pediatric pads is more limited compared to adult pads. You will see the CPR idle timer and hear the rate metronome if compression rates fall below or above AHA recommendations. You will get a display of your compression depth in centimeters. However, it will not highlight, nor will you receive voice prompts such as push harder or good compressions. This is because the compression depth recommendations vary according to the individual child's overall chest depth. Rescuers should aim for a depth of 4 centimeters for infants, 5 centimeters for children, and 5 to 6 centimeters in adults. There is no recoil indicator bar or PPI indicator feedback when using pediatric pads. Let's now review synchronized cardioversion using multifunction pads. The unit displays markers above the ECG trace to indicate the points of the cardiac cycle, or the R waves, where discharge can occur. To do this, apply the multifunction pads. Attach ECG electrodes. Select defib. Select energy. Press sync on. Verify the markers are clearly visible on the monitor and their location is appropriate, for example, not on the T wave. Use the lead and size buttons as needed. A sync Joules select message appears. Press the charge button. Changing energy after charge will disarm the device, so you'll need to press charge again. The shock button lights up. A charge ready tone is heard, and a sync Joules ready displays. Call out stand clear and oxygen clear. Ensure oxygen is clear and no one is touching the patient or bed, and patient is not in contact with metal objects, as can cause unwarranted pathways for defib currents. Press and hold the shock button until the energy is delivered. Failure to hold can result in no shock delivered. Joules delivered and sync Joules message will appear for 5 seconds. Then only the sync Joules message will remain. The device will stay in sync mode once sync is selected, so you'll need to desync in the event of a non-synchronizable rhythm. Let's now review transcutaneous pacing. Apply multifunction pads. The recommended position for both adult and pediatric multifunction pads is anterior-posterior. Ensure multifunction pads are connected to the therapy cable. Connect ECG leads. This device contains a VVI demand pacer, and proper demand pacing requires a reliable, high-quality surface ECG signal. For best results, apply both standard ECG monitoring electrodes and the multifunction pads. Verify proper R wave detection. The heart-shaped symbol flashes with each R wave when proper detection is taking place. Turn selector switch to pacer. Pacer output is automatically set to 0 milliamps. Set the pacer rate to a value 10 to 20 beats higher than the patient's intrinsic heart rate. If no intrinsic rate exists, a rate of 100 beats per minute is recommended as a starting rate. Observe the pacing stimulus marker on the display or strip chart and verify that it is well positioned in diastole. Increase the pacer output until capture. The output milliamp value is displayed. All patients require differing amounts of output to achieve consistent capture. We will simulate here a patient who achieves capture when the output reaches about 50 milliamps. Determination of capture must be assessed both electrically and mechanically in order to ensure appropriate circulatory support of the patient. Electrical capture is determined by the presence of a widened QRS complex, the loss of any underlying intrinsic rhythm, and the appearance of an extended and sometimes enlarged T wave. Mechanical capture is assessed by palpation of a central or peripheral pulse. Determine optimal threshold. The ideal pacer current is at the lowest value that maintains capture, usually about 10% above threshold. Typical threshold currents range from 40 to 80 milliamps. Pressing and holding the 4-to-1 button temporarily withholds pacing stimuli, therefore allowing you to observe the patient's underlying ECG rhythm and morphology. When depressed, this button causes pacing stimuli to be delivered at 1/4 of the indicated pacemaker rate setting. When used in standby or demand pacing mode, the unit automatically provides pacing stimuli whenever the patient's heart rate drops below the pacer rate setting. When used in asynchronous or fixed pacing mode, the device delivers pacemaker pulses asynchronously. I like to refer to this as the steamroller pacing mode, meaning it paces no matter what the patient's intrinsic electrical activity is doing. This mode can be helpful if ECG electrodes are not available or there is some circumstance that prevents or interferes with the ECG. Asynchronous pacing should be performed only in an emergency when no alternative is available. When using transcutaneous pacing, multifunction pads should be replaced periodically. Prolonged pacing in excess of 30 minutes, particularly in neonates or adults with severely restricted blood flow, may cause burns. Periodic inspection of the underlying skin is recommended. To avoid risk of electrical shock, be sure to not touch the gelled area of the multifunction pads while pacing. In this device, the pacemaker settings are maintained if the device is not turned off for more than 10 minutes. Let's now review some of the common monitoring functions of this device. To monitor your patient, turn the mode selection to monitor. There are options for advanced monitoring of pulse oximetry, NIBP, and end-tidal CO2. Options includes QRS volume on and off, which turns the QRS tone on or off, low bright or high bright, which adjusts the screen brightness. Param includes various parameters for each component, such as SpO2, 3-lead, end-tidal CO2, and NIBP. To deploy end-tidal CO2 monitoring, place a single patient airway adapter into place. There's no need to zero between each use. End-tidal CO2 warms up when the defib is turned on. This takes about 60 to 90 seconds, and everything happens automatically. If zeroing is needed, attach the disposable adapter to the cable and leave on room air. Press 0. Zeroing only needs to be performed the first time the device is used, or when switching from the PEDS to the adult sensor, or when the device requests it, or if it's displaying questionable values. To call up the waveform, go to Options, Traces, Trace 3, and End-tidal CO2. For blood pressure monitoring, press the NIBP key once for a stat reading. Press it again to abort the reading. Press Param, Setting, Auto Interval, Set Time for Auto Interval. Ensuring your device is code ready at all times is important for patient safety. This particular device performs an auto self-test every 24 hours. To ensure it passes the self-test, ensure the device is plugged in and that the therapy cable is connected to the one-step multifunction electrodes. A green check mark indicates a pass, and a red X means a fail. If it fails, there will be a message on the screen telling you how to resolve it. In addition to the auto self-test, other daily and/or weekly quality checks should be performed as per the device, instructions for use manual, and/or your institution's protocols.
Okay. Well, that completes the review of the defibrillation, cardioversion, and transcutaneous pacing with their demonstration. I'd be happy to discuss anything that anyone wanted to discuss, or if you had any questions, I'd be happy to take them now. Okay, well, if there isn't any questions, thank you for your attention. And I will upload the video onto our shared drive now, so that you can, so it's there for you if you missed any of it or if you'd like to watch it again. So thanks for having me.
Thank you, Carrie. So